Hello everyone, I am Dr. Jennifer Berman, and today I want to have an open, honest, and science-based conversation with you about a subject that many men wonder about, but few dare to discuss openly. How daily masturbation impacts your prostate health, and what every man should know about it. For years, male sexual health has been surrounded by myths, taboos, and half-truths. Men are told one thing in locker rooms, hear another thing from friends, and often find confusing, conflicting information on the internet. Some are told that masturbation is harmful, others that it is harmless, and very few are ever given a grounded, evidence-based explanation of what it actually does to the male body, specifically to the prostate. And because the prostate plays such a central role in men's health, it is critical to separate fact from fiction. Let us begin with the basics. The prostate is a small gland about the size of a walnut located just below the bladder and surrounding the urethra. Its primary role is to produce seminal fluid, the liquid that nourishes and protects sperm during ejaculation. Though small, the prostate has a huge influence on male reproductive and urinary health. Problems in the prostate can lead to painful urination, erectile issues, or even life-threatening conditions like prostate cancer. So understanding how lifestyle, including sexual habits like masturbation, affects this gland is vital. Now the question arises, so what happens when a man masturbates daily? Does it help? Does it harm? Does it protect the prostate, or does it put it at risk? Science provides us with some compelling answers. Over the last 2 decades, numerous studies have examined the link between ejaculation frequency and prostate cancer risk. One landmark study published in the Journal of European Urology followed tens of thousands of men over many years. The results showed that men who ejaculated more frequently, about 21 times per month or more, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less often. This suggests that regular ejaculation, whether through intercourse or masturbation, may serve a protective role for the prostate. Why is that? The explanation lies in the biology of the prostate. When a man ejaculates, the prostate contracts and releases fluid. This process helps flush out potential carcinogens, bacteria, and stagnant fluids that could otherwise accumulate in the gland. Imagine it like cleaning a filter. When it is regularly cleared, it functions more efficiently. When it remains clogged, risks increase. Therefore, daily or frequent ejaculation may reduce the buildup of harmful substances, keeping the prostate healthier in the long run. But let us look deeper. Ejaculation does more than just cleans the prostate. It also influences hormones. Testosterone and dihydrotestosterone, DHT, are central to prostate health, and irregularities in these hormones are linked to prostate enlargement or cancer. Regular sexual release can help regulate hormone levels, reducing overstimulation of prostate cells. In simple terms, daily masturbation may help balance the very hormones that, when unchecked, contribute to prostate problems. Now, men often ask me, is there such a thing as too much? Can daily masturbation become harmful? The answer depends on context. From a purely medical standpoint, moderate daily masturbation is not harmful to the prostate. In fact, as we've discussed, it may be beneficial. However, the problem arises when it becomes compulsive, when it interferes with work, relationships, or emotional well-being. At that point, the issue is not prostate health, but psychological and behavioral balance. For most men, though, daily masturbation falls within the spectrum of normal, healthy behavior. So let us also dispel a few myths. Some cultures claim that masturbation causes weakness, infertility, or erectile dysfunction. These claims are not supported by science. In reality, masturbation does not reduce fertility, nor does it permanently affect erectile capacity. In fact, by promoting blood flow and exercising the pelvic floor muscles, it may actually support erectile function. The danger lies only in excessive reliance on pornography or compulsive habits, not in the act itself. On the other hand, avoiding ejaculation entirely can present problems. Prolonged sexual abstinence may contribute to congestion in the prostate, leading to discomfort, infections, or an increased risk of enlargement. While abstinence is sometimes chosen for personal or religious reasons, from a purely medical perspective, regular release seems to support prostate health more than abstinence does. Now let's discuss an often overlooked benefit: mental health. Daily masturbation can relieve stress, improve sleep, and boost mood by releasing endorphins and oxytocin, chemicals that reduce anxiety and enhance emotional well-being. Stress, as many of you know, is a silent killer, and chronic stress has been linked to worsened immune function and even increased cancer risk. So by lowering stress hormones like cortisol, masturbation indirectly supports overall health, including prostate health. That said, I also want to highlight balance. Masturbation should be part of a broader lifestyle that includes exercise, healthy diet, regular medical checkups, and emotional connection with partners. Ejaculation alone cannot counteract the effects of obesity, smoking, alcohol abuse, or poor nutrition, all of which increase prostate risk. For true protection, men need a holistic approach. Exercise to improve circulation, diets rich in antioxidants and omega-3s, routine prostate screenings, and yes, healthy sexual activity, including masturbation. It is also worth mentioning that prostate health evolves with age. In younger men, daily masturbation may simply be a natural part of sexual exploration. In middle age, it may play a role in stress management and hormone regulation. And in older men, it may help reduce the risk of prostate enlargement or cancer. Across all ages, though, the consistent finding remains ejaculation, whether from masturbation or intercourse, tends to support prostate health rather than harm it. So what should every man take away from this discussion? First, masturbation is normal. It is part of human biology. It's not a cause for shame. Second, daily or frequent ejaculation is linked with reduced risk of prostate cancer and better overall prostate function. Third, there is no evidence that masturbation causes weakness, erectile dysfunction, or infertility. In fact, the opposite may be true. It helps keep sexual and reproductive systems active and healthy. Fourth, the only risks come when masturbation becomes excessive compulsive, months, or accompanied by guilt and secrecy. In those cases, it is the psychology, not the physiology, that suffers. Let me speak directly to you. Men, your prostate is a small gland, but it plays a huge role in your well-being. Taking care of it requires openness, honesty, and action. Do not shy away from discussions about your sexual health. Do not believe outdated myths that make you fearful or ashamed of your body's natural functions. And do not ignore symptoms like difficulty urinating, pelvic pain, or blood in urine or semen. These can signal prostate problems and require medical attention. And remember, sexual health is not only about preventing disease. It is about living fully, feeling connected to yourself and others, and embracing the natural rhythms of your body. Daily masturbation, when balanced, is one way to support this health. It is not something to hide in shame, but something to understand in truth. So, to every man listening, know this. The hidden science of masturbation is not about indulgence. It is about maintenance, prevention, and well-being. Just as exercise keeps your muscles strong, ejaculation keeps your prostate healthy. Just as eating well supports your heart, regular sexual release supports your reproductive system. What every man must know is that his prostate is quietly affected by daily choices, and masturbation is one of those choices with potential protective benefits. In conclusion, daily masturbation is not harmful. On the contrary, evidence suggests it may reduce the risk of prostate cancer, regulate hormones, flush out toxins, improve erectile function, and support mental health. It is natural, it is safe, and in many ways it is protective. As a doctor, my advice is simple: embrace knowledge, release guilt, and take care of your prostate as you would any other part of your body. Because your health, your vitality, and your future depend on it. Thank you. I am Dr. Jennifer Berman, and I hope this discussion has given you clarity, confidence, and comfort in understanding what daily masturbation really means for your prostate health. I explored the foundations of how daily masturbation influences your prostate health. We looked at the scientific studies, the biology of the prostate, and the myths that surround male sexual behavior. Today, I want to go deeper. I want to take you further into the hidden aspects, the layers of science, psychology, and lifestyle that often go unspoken, but that every man should truly understand if he wants to safeguard his health and live fully. Let us begin with a critical truth: your prostate does not exist in isolation. It is deeply interconnected with your cardiovascular system, your hormones, your nervous system, and your mental well-being. Masturbation is not just a mechanical act. It sets off a cascade of biological responses throughout your entire body. When you understand this, you begin to see why daily habits, even as private as sexual release, ripple into long-term health outcomes. Consider circulation. Every time you become aroused, blood rushes into the penis and pelvic region. This process delivers oxygen, nutrients, and hormones that keep the tissues alive and functioning. During ejaculation, the muscles of the prostate and pelvic floor contract rhythmically, essentially exercising themselves. It is a workout for your reproductive system. Just as lifting weights strengthens your arms, ejaculation strengthens the very muscles and glands that support male sexual health. Without this regular exercise, these tissues can weaken, blood flow can diminish, and stagnation can occur. Now, let us examine the immune system. Researchers have discovered that ejaculation stimulates a temporary rise in white blood cell activity. These are the very cells that patrol your body to fight infections, repair tissues, and maintain balance. For the prostate, this immune response may act like a cleansing wave, protecting against chronic inflammation, a key factor in prostate enlargement and even cancer. In other words, by masturbating daily, you are not only flushing out the gland physically, you are also signaling your immune system to guard it more closely. Another dimension worth understanding is the role of sleep. Many men notice that after masturbation, they sleep more deeply. This is not coincidence, it is chemistry. Ejaculation triggers the release of prolactin and oxytocin, hormones that calm the brain and promote rest. Why does this matter for prostate health? Because deep sleep is when your body repairs itself. It is when damaged cells are replaced, when hormone balance is restored, and when cancer-fighting processes are most active. Chronic sleep deprivation has been linked to higher rates of prostate cancer. So in a roundabout way, daily masturbation may indirectly reduce prostate risk by ensuring you get restorative sleep. But we cannot stop at biology. We must talk about psychology, because shame, secrecy, and guilt around masturbation can sometimes do more damage than the act itself. I have treated countless men who carry deep anxiety over their sexual habits, who fear that daily masturbation is a sign of weakness or addiction. Let me be clear, masturbation becomes harmful only when it takes control of your life, when you neglect work, relationships, or responsibilities because of it. For the majority of men, even daily masturbation is perfectly within the spectrum of healthy behavior. In fact, the men who feel most balanced about it, who accept it as normal, are often the ones with better overall sexual health. Another area that deserves attention is age. A young man in his 20s and a man in his 60s will not experience masturbation in the same way. Younger men may view it as exploration, older men may use it as maintenance, but across all ages, the consistent finding remains ejaculation frequency is linked to reduced prostate cancer risk. Even in men over 50, frequent ejaculation has been associated with healthier prostate function. That means it is never too late to benefit. Now let us tackle one of the most persistent fears men carry. Does daily masturbation lower testosterone? This is a myth that refuses to die. The truth is no, masturbation does not drain your testosterone levels. In fact, some studies suggest that sexual activity, including masturbation, may help keep testosterone balanced by preventing long periods of stagnation. What is lower testosterone? Lack of sleep, obesity, excessive alcohol, chronic stress, and certain medical conditions. So if you are worried about your hormones, focus less on masturbation and more on lifestyle. Speaking of lifestyle, we must acknowledge that masturbation is only one piece of the prostate puzzle. Diet is another major factor. Foods rich in antioxidants like tomatoes, berries, and green tea provide natural protection against oxidative stress in prostate tissue. Omega-3 fatty acids from fish reduce inflammation. Zinc, found in pumpkin seeds and nuts, supports healthy testosterone function. And let us not forget exercise. Men who remain active have significantly lower rates of prostate disease than those who are sedentary. When combined with the cleansing benefits of regular ejaculation, these lifestyle habits form a powerful shield for your prostate. But I also want to warn against extremes. Some men hear that ejaculation is beneficial and then push themselves into compulsive behavior, believing that more is always better. Remember, balance is key. The goal is not to turn masturbation into an obligation or competition. The goal is to integrate it naturally into your life as one aspect of self-care alongside proper diet, exercise, and regular medical checkups. Let me share a clinical perspective. Over the years, I have seen patients who struggled with chronic prostatitis, a painful condition marked by inflammation of the prostate. For some of these men, regular ejaculation, yes, even daily, was part of their treatment plan. By keeping the gland active and preventing congestion, symptoms often improved. This shows how deeply tied prostate health is to sexual activity. What was once viewed as indulgence has proven to be, in some cases, therapeutic. Now, I want to emphasize another overlooked benefit: intimacy. Even when masturbation is a solo act, it can improve a man's confidence, self-awareness, and sexual control. Men who know their own bodies, who are comfortable with their own arousal, often perform better in partnered relationships. They last longer, communicate more openly, and feel less anxious. This matters because stress and sexual frustration can fuel prostate problems. A relaxed, confident man is a healthier man, and his prostate benefits too. Finally, let us talk about screenings. No matter how much you masturbate, no matter how healthy your lifestyle, every man over 40 must take prostate screenings seriously. Prostate cancer is often silent in its early stages. Regular checkups, PSA tests, and medical guidance are non-negotiable. Daily masturbation may lower risk, but it does not replace the role of modern medicine. Think of it as one tool in your toolkit. Powerful, yes, but not complete on its own. So, as we conclude this next chapter, let me leave you with this perspective: your sexual health is not shameful, and it is not trivial. It is foundational. Daily masturbation is not merely a private act. It is a practice that touches your hormones, your circulation, your immune system, your mental health, and ultimately your longevity. When done in balance, it is not harmful. it is protective. It is not weakness, it is wellness. I urge every man listening to take ownership of his prostate health. Do not shy away from discussing it, do not let myths mislead you, and do not underestimate the role of something as simple, natural, and accessible as masturbation. It may be one of the most underappreciated tools you have for maintaining your vitality. Thank you once again. I am Dr. Jennifer Berman, and this has been another step in understanding the truth about daily masturbation and prostate health. In our next discussion, I will dive even deeper into how emotional intimacy, sexual frequency, and lifestyle choices interact to shape not only your prostate, but your overall health as a man.